I'm Mason with Live Oak Testosterone here in San Angelo, Texas. And I get it. The internet makes growth hormone peptides sound like there's some kind of underground biohacking wizardry. But in our clinic, we use them responsibly, and only the ones with real human safety data, Sermorelin and Tesamorelin. In this video, I'll explain what these peptides actually do, how they safely nudge your body to release its own growth hormone, not replace it, and why that natural rhythm is what drives better sleep, recovery, and metabolism. We'll break down how Sermorelin and Tesamorelin work, who benefits the most, how they compare, and what the data says about fat loss, muscle preservation, and long-term safety. I'll also show you how we pair them with GLP-1 medications to protect lean mass during the rapid fat loss. Because right now, people are buying mystery vials online or running peptides they don't understand and then wondering why they feel worse instead of better. This isn't about chasing superhuman hormones. It's about helping your body remember what it used to do best. All right, let's talk about growth hormone peptides. These are one of those topics that sound like biohacking wizardry, but when you understand them, they're really just ways to nudge your own biology back to what it did naturally in your 20s. Now, there are a lot of peptides that claim to boost growth hormone: CJC1295, ipamorelin, hexarelin, IGF-1 analogs. But we really try to focus on the two that actually have some human safety data and FDA-approved equivalents, Sermorelin and Tesamorelin. So those are the two that I've really offered the most these days. So how do they work? Both Sermorelin and Tesamorelin are growth hormone releasing hormone analogs. That means they don't replace growth hormone. They ask your pituitary to release it naturally. That's the big difference. They're not forcing growth hormone into the body. They're nudging your own system to optimize release. Somatostatin, you have a built-in brake to where you can get physiologic pulsatile growth hormone release instead of unregulated constant exposure like you would with straight hormone injections. Why is natural rhythm the key? It's what drives better sleep, recovery, metabolism, and body composition without overriding the negative feedback control. Now, people often ask, if we're increasing growth hormone, doesn't that increase the risk for a growth hormone dependent cancer? And that's a great question. So let's use the extreme data of growth hormone secreting pituitary hormone that has constant growth hormone release around the clock for years. And yes, those patients do have high risk of colorectal and sometimes thyroid cancer. That's from long-term unregulated growth hormone and IGF-1 exposure. But that's not what we're doing. Sermorelin or Tesamorelin keep the normal pituitary feedback loop intact. The brake, somatostatin, still works. We're not overriding the system, we're working with it. And when growth hormone therapy is done responsibly, the data supports its safety. Studies and position papers like the 2022 Growth Hormone Research Society and the European Society of Endocrinology consensus statement found no increase in new cancers or reoccurrence in growth hormone deficient adults treated with monitored growth hormone replacement. Even a 2016 meta-analysis suggested no increase and possibly even a lower overall risk in patients with controlled growth hormone therapy. So the concern with cancer comes from unregulated excess, not from restoration. We work to keep your IGF-1 within physiologic range. We can monitor it, and we respect the feedback system. So how do you choose between Sermorelin or Tesamorelin? If we're ranking effectiveness, Tesamorelin is the MVP. It's actually FDA approved for HIV-associated lipodystrophy, which is the fancy word of saying visceral fat accumulation. That's the dangerous fat that wraps around your organs. In clinical studies, Tesamorelin cut visceral fat by about 15% on average, while increasing IGF-1 levels and helping preserve lean muscle mass. Patients notice their midsection tightening, their sleep improving, and their recovery getting faster. That's why we use Tesamorelin. The majority of the time, it delivers measurable changes in body composition and has the best human safety data of all the growth hormone peptides. However, Sermorelin is the classic short-acting option. It's perfect for restoring the rhythm of growth hormone release. It helps people want better sleep, joint recovery, or natural energy without pushing too hard on the system. You can somewhat think of it like Tesamorelin is the high-performance model and Sermorelin is the reliable daily driver. Both get you where you want to go, they just have different routes. So who benefits with these? Men and women with stubborn visceral fat, especially around the abdomen. Tesamorelin has proven visceral fat reduction data, and helps maintain lean mass while cutting fat. Patients utilizing GLP-1s can do really good with these, like semaglutide or tirzepatide. Semaglutide and tirzepatide are incredible for fat loss, but if you're not doing resistance training or getting your protein in, they can lead to some muscle loss too, especially if the calorie deficit is way too steep. Adding Tesamorelin or Sermorelin may help maintain that muscle mass and overall keep your metabolic rate up. There are studies and meds that may even be combined in the future that are combining their effects. Sermorelin and Tesamorelin help really well with people who have poor sleep and muscle recovery. Sermorelin helps restore slow wave sleep and helps support collagen, tendon, and soft tissue repair. I know they work well whenever I take them. I get dreams that are a trip to be on, and so it's almost fun going to sleep while you take them. Another population that may benefit from these are middle-aged men and women noticing slower metabolism and recovery. Growth hormone rhythm declines naturally with age, and these peptides help reestablish it safely. I would say the ones that get it the most benefits out of it are athletes or active professionals who want improved recovery, stamina, improving a healthy body composition without overall breaking physiology. So again, I kind of alluded to this earlier, but what about combining them? GLP-1 and the GH secretagogues. GLP-1 medications have changed the weight loss forever, but you have to be purposeful in keeping your muscle mass with resistance training and protein intake. In the future, there's going to be a combination of these. The GLP-1s to drive the fat loss, growth hormone releasing peptides like Tesamorelin or Sermorelin to preserve or even rebuild lean mass. Growth hormone releasing peptides like Tesamorelin or Sermorelin will help to preserve or even rebuild lean mass, and comprehensive lifestyle medicine to help the results durable. Studies for these combos are already underway with promising results. With peptides becoming more and more mainstream, I just wanted to get some more information out there. We utilize them of a broader plan for hormone balance, metabolism, long-term wellness, and we try to use the ones with the most human safety data. We dose physiologically, and we monitor labs and outcomes closely. And even though I think they provide a better hormonal environment to be cancer protective, we still make sure that you have appropriate cancer screening done prior to bringing these on. Tesamorelin leads for visceral fat loss and recomposition. Sermorelin supports recovery and sleep, and together they help the body remember what optimize actually feels like. Our goal isn't to chase superhuman hormone levels, it's to restore balance, to help your body perform, recover, and age in a healthy way. So if you're curious about peptide therapy, especially as part of a comprehensive plan for weight loss, hormone optimization, longevity, reach out and we'll tailor it to you, your labs, your goals, your lifestyle, because it's not about hacking your hormones. It's about helping your body remember what it used to do best. If you're thinking about adding peptides to your stack, let us know. We'll be happy to give you all the information you need over them. Like and subscribe for more information over them. Let's keep you optimized, not hospitalized.